Good morning and welcome. Today is Saturday, October 15, 2022. This is the 14th Global Ethiopian Diaspora Conference organized by People to People. And the theme of the year is evaluating the quality of medical education in Ethiopia, high time for course correction. Before we go to the different sessions of the conference, I would like to invite Professor Naugao Mari, the president of People to People and the one who established this energetic, 2 decades old organization.
Good morning, and thank you, Dr. Kabada, for the nice introduction. Your Excellencies, professors, scholars, members of the People to People communities, Dr. Antone, People to People board chair, Dr. Kabada Benya, conference chair and P2P executive vice president, and all the students and volunteers joining us today. I just want to, at the outset, just say a few words about the unfortunate occasion, what happened this morning. Although like P2P was poised to host the conference at Howard University, because of some noises that put pressure on the universities, they have declined to host us. However, in the land of freedom in America, people have the right to deny, particularly academic freedom, to discuss issues such as healthcare, education. So although they tried, they will stop us, but we are glad to inform everybody we are in a different venue and the program will continue as planned. Good morning and very warm welcome to everyone, whether it is morning, afternoon, or evening, your time. People to People is a non-governmental organization which, since the birth in April 1999, without any affiliation in ethnic, religion, or politics. Only our affiliation is Mosaic Ethiopia, has served as a bridge to transfer knowledge and technology by connecting individuals, groups, universities, institutions, and communities across Ethiopia and its global diaspora communities. People to People headquartered in the US with a regional office in Ethiopia. As the spirit of kindness spread, it has stretched its wings and become international, such as People to People Canada, Sweden, Finland, Germany, Switzerland, with members over 100,000. P2P manages a number of programs with a unique model that we call triangular partnership. The annual conference platforms is one that was started 14 years ago. Over the years, it has tried to address a number of critical challenges, continuing medical education, debate on quality medical education. Last year's P2P has focused on a Horn of Africa program, particularly on COVID and its challenges. In this context, P2P is grateful to its Horn of Africa representatives in all the regions. The annual conference program is designed to examine ways to address medical healthcare challenges, regional security issues, address the future, to learn from each other, to inform discussion with diverse voices from policymakers, scientists, university leaders, and to consider how we might move forward in a stronger, more collective ways in the future. Although ongoing challenges like economic crisis, global pandemics, the threat of sanctions, war, and disrupted supply chain continue to stress our country, a conversation concerning the short to medium term prospects and challenges must remain ongoing. Not only must it remain ongoing, but also informed by the work of the university research teams, civil society organizations like People to People need to examine these issues on a day-to-day basis In this context, I'm delighted to say many scholars from various universities, policymakers, both from the diaspora and Ethiopia. In addition to the speakers, moderators who joined us today, I would like to thank the P2P volunteers who made this conference possible. And I wish all the participants and the moderators and panelists a very productive day. Thank you very much.
Thank you, Professor Naugao. There are 4 sessions to be discussed today. Before that, according to the schedule, we were planning to have His Excellency Ambassador Seleshi to address the conference. Because of conflicting schedules, he delegated Ambassador Bogale Tolosa to transmit his message. Dr. Bogale Tolosa is a graduate with Master's and PhD with Agricultural Economics. He worked in different fields, including agricultural and foreign sector in Ethiopia. And he has been involved in the Diaspora Affairs Office in Poland before he moved to the United States and worked with the current ambassador, whom you know, who has said, do Ethiopians have the right to drink from Nile? I remember him very well in his speech in the UN. So without further ado, I invite Ambassador Bogale Tolosa to share to address the audiences. Thank you.
Thank you so much, Doctor. My name is Bogale Tolosa, as you mentioned it. I'm responsible here at the Ethiopian Embassy in Washington for diaspora affairs. As you said, I'm here today representing His Excellency His Excellency Ambassador Dr. Seleshi Bekkele. I will deliver his speech now. I have a speech in Amharic, probably. የተከበራችሁ የኢፌዴሪ የጤናና የትምህርት ሚኒስትሮች ክብርት ዶክተር ሊያ ታደሰ እና ክቡር ዶክተር ብርሃኑ ነጋ፣ የተከበሩ ዶክተር ናጋው መሐሪ የፒፕል ቱ ፒፕል መስራች እና ፕሬዚዳንት፣ የተከበራችሁ የዚህ ጠቃሚ ኮንፈረንስ አዘጋጆች ማለትም የፒፕል ቱ ፒፕል እና the network of African diaspora healthcare professionals የቦርድ አመራሮችና አባላት፣ የተከበራችሁ የዚህ ኮንፈረንስ ተሳታፊዎች፣ ክቡራትና ክቡራን፣ በአሜሪካ የኢትዮጵያ ልዩ መልእክተኛና ባለሙሉ ስልጣን አምባሳደር ክቡር ዶክተር ስለሺ በቀለ በዚህ ኮንፈረንስ ላይ ጥሪ ከመድረሱ በፊት ቀደም ብለው በተያዘ ፕሮግራም መደራረብ ምክንያት ዛሬ መገኘት ባለመቻላቸው ይቅርታ ጠይቀዋል። መልእክታቸውንም እንዳስተላልፍ ልከውኛል። ስለዚህ የእሳቸውን መልእክት አቀርባለሁ። ከሁሉ አስቀድሜ evaluating the quality of medical education in Ethiopia, high time for course correction በሚል መሪ ቃል በሄልዝ ኬር እና በሜዲካል ኤጁኬሽን ጭብጥ ላይ ያተኮረ በፒፕል ቱ ፒፕል እና በዘ ኔትወርክ ኦፍ አፍሪካን ዲያስፖራ ሄልዝ ኬር ፕሮፌሽናልስ የተዘጋጀውን 14ኛውን ዓመታዊ ዓለም አቀፍ የኢትዮጵያ ዲያስፖራ ኮንፈረንስ በንግግር እንዲከፍት እድል በማግኘቴ ታላቅ ደስታ እየተሰማኝ ይህን ወቅታዊና ለሀገራችን እጅግ ጠቃሚ የሆነውን ኮንፈረንስ ያዘጋጁትን አካላት በራሴና በዋሽንግተን ዲሲ በሚገኘው የኢትዮጵያ ኤምባሲ ስም ላመሰግን እወዳለሁ። በአሁኑ ወቅት በአንድ በኩል በኢትዮጵያ ያለው ህዝባችን ማህበራዊና ኢኮኖሚያዊ ችግሮች ለመቅረፍ እየተደረገ ያለው እንቅስቃሴ ለመደገፍ፣ በሌላ በኩል ደግሞ ሀገራችን የገጠማትን የሰላም እጦት ችግርና የዓለም አቀፍ ጫናዎች ለመቋቋም የሚደረገውን ሁለገብ ጥረት ውጤታማ እንዲሆን በአሜሪካ የሚገኙ የዲያስፖራ አደረጃጀቶች ከፍተኛ ሚና በመጫወት ላይ ናቸው። ከነዚህ መካከል ደግሞ የፒፕል ቱ ፒፕል አንዱ ሲሆን ከሁለት አስርት ዓመታት በላይ በጤና ዘርፍ ከፍተኛ ልምድ ያካበተ ከመላው የዓለማችን ክፍል በርካታ አባላት ያሉት የኢትዮጵያ ዲያስፖራ አደረጃጀት ነው። ፒፕል ቱ ፒፕል በርካታ የጤና ፕሮፌሽናል የኢትዮጵያ ዲያስፖራ አባላት በሀገራችን ከሚገኙ የጤና ዘርፍ ላይ ከተሰማሩ የጤና ተቋማት ጋር በመገናኘት የዘርፉን አቅም በማበልጸግ እንደ ድልድይ በመሆን ሀገሩን ኢትዮጵያ እያገለገለ ያለ በተግባሩና በውጤቱ ሁሉም የምንኮራበት ብርቅዬ ሀገር ወዳድ ኢትዮጵያን ስብስብ ነው። ጥራት ያለው የጤና አገልግሎት ለሕዝባችን እንዲቀርብ የራሱን አስተዋጽኦ እያበረከተ ይገኛል። ከዚህ በተጨማሪ በጤና ዘርፍ የመፈጸም አቅም ለመገንባት መንግስት እያደረገ ያለውን እንቅስቃሴ በመደገፍ በተለይ የጤና ባለሙያዎችን አቅም በመገንባት የእውቀትና ቴክኖሎጂ ሽግግር እውን በማድረግ ተምሳሌታዊ ስራ ሰርቷል። ፒፕል ቱ ፒፕል በዓለም በአስጨናቂው የኮቪድ-19 ወረርሽኝ በታመሰችበት ወቅት እንኳ እንደኛ ላሉ ሶስተኛ ዓለም ሀገራት ይቅርና እጅግ ለበለጸጉ ሀብታም የዓለማችን ሀገራት ወረርሽኙን መከላከልና የደረሰውን ጉዳት መቆጣጠር በተሳናቸው ጊዜ እንዲሁም ሁል ጊዜ ግራ በተጋባበት በዛ በጨለማ ወቅት በውጭ ሀገራት የሚኖሩ ኢትዮጵያና ትውልድ ኢትዮጵያን በመርዳት በመደገፍ እንዲሁም ሀገራችን ከወረርሽኙ ለመታደግ በገንዘብ በቁሳቁስ በእውቀትና በጉልበት አለኝታ በመሆን አስፈላጊውን ድጋፍ ያደረገ ድርጅት ነው። ከዚህ በተጨማሪ በተፈጥሮና በሰው ሰራሽ አደጋዎች ላይ ጉዳት የደረሰባቸውን ዜጎቻችን እና የወደሙ መሰረተ ልማቶችን መልሶ ለማቋቋምና ለመገንባት የቀረበለትን ሀገራዊ ጥሪ በመቀበል እየተደረገ ያለውን ሀገራዊ እንቅስቃሴ በመቀላቀል የበኩሉን ድርሻ በመወጣት ላይ ይገኛል። በመሆኑም የፒፕል ቱ ፒፕል ስራ አመራር ቦርድ እና አባላቶች ለእናት ሀገራችሁ ኢትዮጵያ እያደረጋችሁ ስላለው ትርጉም ያለው ድጋፍ በራሴና በዋሽንግተን ዲሲ የኢትዮጵያ ኤምባሲም ከልብ አመሰግናለሁ። እግዚአብሔር ይስጥልኝ እላለሁ። ክቡራን ሚኒስትሮች፣ የተከበሩ የዚህ ኮንፈረንስ ተሳታፊዎች፣ ባለፉት ጥቂት ዓመታት በሽታን በመከላከል አክሞ በማዳንና ለወረርሽኝ የማይበገር የጤና ስርዓትን ዘርግቶ በመተግበር የጤና ባለሙያዎችን ተነሳሽነትና ብቃት ለመጨመር የሚያስችሉ የሙያ ማጎልበቻ ስርዓት ተግባራዊ በማድረግ ጥራት ያለው የሕክምና አገልግሎት ተደራሽ በማድረግ የጤና አገልግሎቱን ለሁሉም ህብረተሰብ ክፍል ማድረስ የሚያስችል አቅም በመገንባት በአጠቃላይ በሀገራችን በጤና ስርዓት ላይ ልማት ዙሪያ ህዝባችንን ለመጥቀም የተሰሩ ስራዎች እና በጤናው ዘርፍ እየታየ የመጣው እድገት እሰየው የሚያሰኝ ነው። ይህ እንደተጠበቀ ሆኖ ሀገራችን ኢትዮጵያ የኮቪድ-19 ወረርሽኝ ጥሎ ያለፈብን ተጽዕኖ በመጋፈጥ ፊቷን ወደ ልማት ባዞረችበት በዚያ ወቅት አሸባሪው ህወሓት በሰሜኑ የሀገራችን ክፍል የቀሰቀሰውን ጦርነት ተከትሎ በተለይ በአማራ እና በአፋር ክልሎች በርካታ ሰብአዊና ቁሳዊ ጉዳት ደርሷል። ጦርነቱ ለዜጎች ህይወት ማለፍና መፈናቀል ምክንያት ሆኗል። ከነዚህ ቁሳዊ ጉድለቶች ውስጥ ደግሞ ዋናዎቹ የማህበራዊ ሴክተሮች መሰረተ ልማቶችና ተቋማት ናቸው። በርካታ የጤናና የትምህርት ተቋማት ወድመዋል። ይህንን ጉዳት ለመጠገን ሀገራችሁ ኢትዮጵያ እንደ ካሁን በፊት ሁሉ ከጎኗ ሁናችሁ አለውልሽ እንድትሏት ጥሪ ታስተላልፋለች፣ ድጋፋችሁንም ትሻለች። በመሆኑም ይህ ጉዳይ በኮንፈረንሳችሁ ላይ ትኩረት አግኝቶ በውይይት እንደሚደረግበት ተስፋ አደርጋለሁ። በመጨረሻም ፒ2ፒ የሀገራችን ማህበራዊ ልማት ፒፕል ቱ ፒፕል የሀገራችን ማህበራዊ ልማትና ዘርፍ በመደገፍ የሚያደርገውን እንቅስቃሴ ውጤታማ እንዲሆን በዋሽንግተን ዲሲ የሚገኘው የኢትዮጵያ ኤምባሲ ከጎናችሁ በመሆን አስፈላጊውን ድጋፍ እንደሚያደርግላችሁ ላረጋግጥላችሁ እወዳለሁ። ኮንፈረንሱ ውጤታማ እንደሚሆንም መልካሙን ሁሉ እመኛለሁ። አመሰግናለሁ።
Thank you very much, Ambassador Bogale, for your interesting advice and good wishes. proceeding, there are some changes on the schedule. The keynote speaker is going to be in the afternoon. So we'll go to the first session, which is going to be dealing with quality of medical education and healthcare, which is really one of the corner topic of this session. And the moderator of this session is Professor Associate Dr. Lakida Lutadese. She is an associate professor of pathology at Howard University with many years of experience in teaching and also improving the quality of health services and education. So she's going to be the moderator of this session, and I will leave the floor for Professor Lucky. Thank you.
Good morning. I believe on the schedule, the person to speak, I just want to make sure, Dr. Kabada, do we start with the panel discussion now?
Just before that, there is an address by the Health Minister of Ethiopia, Dr. Lia Tadese. So because of some conflicting situation, we are going to have a video address from her. So we'll play that one. After that, you will take over the floor.
Distinguished guests, dear colleagues and friends, good morning, good afternoon, and good evening, since you are participating from different parts of the world. It is my great pleasure to deliver this brief message on this year's annual conference of People to People, addressing one of the most important aspects of health service and health workforce quality, which is accreditation. The 2018 Lancet report estimates that 5 million people die every year because of poor quality of healthcare in low and middle income countries. That's significantly more than the 3.6 million people in those countries who die from not having access to care. It is believed that the major contributor to the poor quality of healthcare is gaps in health professionals' competency. The importance of accreditation and licensure of medical schools to improve the quality of medical education is well recognized globally. Effective accreditation is considered an essential ingredient for any system of health science education. That was why the World Health Organization and the World Federation for Medical Education established an international task force on accreditation in medical education in 2004. In the past 2 decades, Ethiopia has made significant investments to boost the number and mix of health professionals. In those years, the Minister of Health and the Minister of Education have been working together in designing curricula and health science education standards, in building medical schools capacity, in faculty development, and more. Those collaborative works were to improve the quality of medical education, thereby producing competent and skilled health professionals. Since 2019, the Minister of Health has started conducting a national licensing examination to be licensed to practice in Ethiopia. This examination has started playing its role in improving the quality of healthcare service and quality of education. Recognizing the role of program accreditation for the quality of education, the Ministry of Health and its partners have made several discussions on the issue. Accordingly, the ministry was heavily involved in the development of program quality development standards, accreditation guidelines, and assessment tools. We have a strong belief that program accreditation will help to produce quality graduates, thereby improving the quality of healthcare service. And we also believe that program accreditation will help our graduates to be competitive globally. In this regard, I would like to recognize and appreciate the efforts of Dr. Naugao and the People to People team for the collaborative initiative we are working on to accelerate our progress in program accreditation, of course, among many of our partnerships with P2P. And I believe the P2P annual conference that's being held today will have a catalytic role for our ongoing efforts to ensure quality of health services and to promote dialogue and cooperation among stakeholders in pushing this agenda forward. With this, I would like to wish you a productive discussion over the course of the conference and very much look forward to continuing our conversation and our collaborative efforts. I thank you.
Okay, thank you so much, Dr. Kabada. Again, if everyone can hear me, just make sure that you can. The next part of today's session that we're going to start is going to be a panel discussion. But before we do the panel discussion, I have a very brief presentation to set up and introduce the panelists. So I'm going to share my screen to do the presentation. So for a very brief sort of background and introduction to set us up for the panel discussion, I just want to highlight that the reason for the accreditation, the reason why we're here, the reason why we're discussing about accreditation is now it's a worldwide issue. It's primarily driven by the fact that due to the significant healthcare workforce shortage all over the world, in the last 20 years, there has been a very rapid expansion of medical schools with a very high mobile workforce. And so WHO has initiated a program to try and ensure quality of medical education and accountability of physicians' standards and medical education to ensure that not only quality healthcare is being provided to the countries where these physicians are trained, but because there is this cross mobility across the world, and also, you know, health has become very global, and to prepare our physicians for a global workforce. So quality became a major issue because of the rapid proliferation of medical schools. And this is the experience of medical schools across the world. This is not something unique for Ethiopia. So the drivers for accreditation are both internal within Ethiopia as well as externally. Within Ethiopia, the Ministry of Education is the authority that is predominantly responsible for overseeing quality of education, and what used to be HERCA, Higher Education Relevance and Quality Agency, now Education and Training Authority, is the authority that has the mandate to accredit and ensure quality of education across the board. And their objective is to provide efficient and transparent accreditation system. The Ministry of Health is responsible for the national workforce when it comes to healthcare. And again, as part of their strategic plan, improving quality of pre-service education and training by strengthening accreditation and licensing and regulation is one of their main aims. So there are two bodies that are predominantly engaged and responsible to ensuring quality. Externally, in the international world, like I said, WHO is the one that is pushing the quality issue. And in fact, a good decade ago, they had made a declaration that by 2020, all countries will have established accreditation mechanisms for health training institutions. And we're certainly working our way to achieve that goal and go beyond that. As important as that, the body that ensures equivalency of medical education to enter residency program in the United States, known as ECFMG, starting from January 2024, they have changed their rules that for any physician internationally trained to enter postgraduate medical residency training in the United States is going to require graduation from an accredited medical school, and this medical school would be recognized by the World Federation of Medical Education. So we've got our work cut out for us. As you know, accreditation is incredibly beneficial. It's not a fact that just the WHO is mandating it, or we have these sort of bodies requiring it. It is something that is incredibly important as an effective quality improvement tool. It encourages self-improvement. It facilitates planning and implementation of change, and it demonstrates the commitment of organizations to excellence. And an added benefit to this particular process that we're embarking on gives international recognition to schools when it comes to their quality. So how does the accreditation process work? Ethiopian Training Authority is the body that has been given the mandate to accredit institutions. Therefore, it is the accrediting agency. Ethiopian Training Authority accredits all educational institutions, but our focus is obviously the medical school because we're talking about the program of medical education being accredited. And this is a recurring process where ETA accredits medical schools, does a follow-up, and the accreditation is given for a time period, and there's a recurring process that has to take place. So this is currently in progress. The layer that's going to be added on top of that is if we stay in this model, the accreditation will work, the quality assurance will be there within the country internally, but the international recognition and accepting of this model has to occur at a level that's different than this. So what is that arm? That arm is the World Federation of Medical Education. The WFME does not accredit individual medical schools in Ethiopia. What it does, it oversees the Ethiopian Training Authority's accreditation process. It evaluates it, and through a very rigorous process, WFME, after that rigorous process, gives the recognition to the ETA as the accrediting body that is world recognized by the WFME. When that happens, all the medical schools that have been accredited by ETA automatically get an international recognition. So this is where the process is. Again, the WFME recognition for ETA is a recurring process. So accreditation in Ethiopia, like I said, the whole idea is to ensure quality medical education, and ETA is going to do that by accrediting all medical education programs. The next step is to obtain international recognition for the accreditor, which is ETA by WFME. And once ETA is accredited, all medical schools get international recognition. Certainly, it is a challenging task, and much work has already been done. So what we're going to do in this panel discussion is to show you the various organizations that have been playing an important role and to hear from them. To set that up, as you can see in the middle of the panel, is the Ethiopian Training Authority, which is the accrediting body that has been given the mandate. That authority they report to the Ministry of Education, and their job is to accredit all medical schools within Ethiopia. So that's the current setup. Now, what are the organizations that support this process? The two main organizations are the Ministry of Health in Ethiopia and the Ethiopian Medical Association. They have played an enormously important role from the inception of any quality improvement and quality review, and they will explain to us what those specific tasks have already been accomplished. As I've already noted, WFME is going to come in as an international organization to try and validate the accrediting power and the accrediting work of ETA. So this is the setup that currently is happening. What we have done with People to People is joined this collaborative effort where a group of people from P2P have gotten together to lend a supporting hand for this process, because there are people within the People to People task force that we put together that have specific experiences in accreditation in higher education in general, and specifically to medical school. So we thought that would be a wonderful addition for us to say, what can we do to help this process along? So once I've set this up for you and I've told you which are the key organizations, I am going to introduce our panelists. Obviously, before I do that, here is a picture of the wonderful black lion from Ethiopia. And the quote, "It always seems impossible until it is done," by Nelson Mandela kind of came to my mind as we're embarking on this journey that seems to be like a pretty daunting task, but we will get it done. And so introducing our panelists, I'll introduce all of them, and then we will start with each where they're going to tell us their role in the medical education accreditation process, the work that has already been done, what is planned for the future, and anything they want to share with us. Our first panelist is going to be Dr. Dunkana Nabusa-Kenny. He's the Deputy Director General of the Accrediting and Standardization of the Ethiopian Training Authority. So he is the focal and most important person in this accreditation process, because he leads the effort to undertake the accreditation. The next speaker on our panel list is Professor Abraham Hailamlak. He's a program advisor at Human Resources Development Director at the Ministry of Health in Ethiopia. He is a professor of pediatrics and child health, and I believe he was also the former dean of Jimma University Medical School. He has extensive experience in the accreditation process. He is the senior advisor, and he's been involved in every step, and is still currently leading the effort. Atwa Seged is the Human Resource Development Director at the Ministry of Health in Ethiopia. Again, the human resource development sector plays a critical role in ensuring not only the health workforce, but their accreditation. And accreditation is obviously, licensing, and licensing is going to be definitely linked to accreditation. So he has an enormous experience in leading this area. And also he's very involved with the Ministry of Education and ETA and HERCA in developing many of the quality standards that we're going to talk about. Dr. Tagvar Idzau, he is the current president of the Ethiopian Medical Association, but he also plays several other roles. I believe he plays a leadership role in the international organization JAPIGO. He has also been, he's a FAMER Fellow, which is one of the fellowships given to highly qualified international candidates to improve quality medical education. He has been very instrumental and involved with Professor Abraham and Atwa Seged for a long time in the quality process when it comes to the medical education accreditation. Dr. Amal Saleh is the interim dean of the School of Medicine at Abba University, and she is the president of the Council of Medical Education. I believe this is a council where all the deans of the medical schools get together to undertake many leadership initiatives, and she is representing the Council of Medicine on behalf of all the deans of the medical schools, and she will tell us about the role of the medical schools in preparation for the medical education. Dr. Dawit Taklu, if he might have had some difficulty joining us, if he is able to join, is a commissioner for academic accreditation at the UAE. Prior to joining the Commission for Academic Accreditation, he had played very significant roles in 2 universities in the United States and leadership roles, both of which had to do with assessment and quality, where he was the leader for those institutions in preparing the institutions for national accreditations. So having introduced our panelists, I will open the floor for the first speaker. We will go in the order that I introduced them. And so Dr. Dunkana, if you can join us and give us an insight and introduce us to the world of ETA, its role in the accreditation, current status, and where we're heading. Thank you.
Good morning and good afternoon, everybody. And thank you for giving this opportunity to appear here in this very international conference, which focuses on education, especially quality of education. I want to briefly introduce you the former HERCA, and Education and Training Authority has been evolved from the previous HERCA, Higher Education Relevance and Equality Agency. And this institution was established 20 years ago, and its major mandate was to accredit private institutions and also to audit public institutions. In the last 20 years, this institution has licensed more than 350 private institutions and also audited more than 100 public institutions. The major objective of the institution was to check the relevance of programs run by institutions, especially private institutions. And now, Education and the Training Authority has been evolved from HERCA by revising its former mandate. Nowadays, it is called Education and Training Authority, mandated to oversee the quality and relevance of TVET as well as higher education institutions. And also we have revised the whole setup of the institution, and we have evaluated seriously the practices of HERCA, and we have changed thoroughly the approach, the quality assurance approach to higher education as well as TVET. And we structured ourselves in such a way that according to our context, to accredit institutions, license or provide license to new coming institutions, as well as also to check whether institutions are operating according to the licenses provided to them. So we are nowadays working seriously on accreditation, quality audit, and authentication of the documents produced by different institutions, especially the private institutions. At the present, we are designing standards for accreditation to accredit institutions and their programs. We are intending to accredit institutions as well as their programs. Now, as a pilot project, we have started accrediting health sciences and medical education. We have already evaluated 4 health science and medical education programs at 2 institutions. And this will help us to seriously and thoroughly see the application of this instrument as a quality assurance process. And we have changed our approach as well as the instruments we were using for the last 20 years. And nowadays we have developed, with the help of JAPIGO, standards for accreditation, self-evaluation guidelines, checklists, and we are now evaluated institutions. And nowadays we are developing reports of the outcomes of the evaluation system. So in the future, we will aggressively move to accrediting all programs provided by public as well as private institutions, higher education, higher learning institutions. Now we are developing standards, checklists, self-evaluation documents, and we are going to launch these instruments, quality assurance instruments, in the coming 3 to 6 months, and we'll start soon accrediting the institutions as well as the programs. Thank you very much.
Thank you very much, Dr. Dunkana, for the excellent overview of the Ethiopian Training Authority, the historical background of HERCA from which it came, the work that has already been done and what is being planned for the future. I hope that will give our audience and all of us participating a little bit of an idea. I know there was a lot of work that has already been done. It's very hard to summarize it in a short period of time, but I think he's highlighted. We're talking about a good decade plus of work when it comes to overseeing quality. So thank you very much for that update. I want to invite next Professor Abraham to give us a brief overview. I know you are representing Ministry of Health in terms of you being the program advisor, but you had served in the role of dean when the quality process was being developed. So both from your perspective from the Ministry of Health as the dean, give us an idea of the journey towards accreditation and any wisdom that you want to share with us.
Thank you all. The journey for program accreditation of health science programs started years back. And by then, there was no consensus among major stakeholders, and that was a bottleneck, and we couldn't progress as expected. Some 2 years back, representative from Ministry of Health, the former HERCA, now ETA, and EMA, as well as Ministry of Education, we sat down and discussed, and we reached in consensus to undergo health science programs accreditation. And by then, jointly, a steering committee to oversee this process was set, and also a task force was set. The task force was responsible to develop working documents, which we said the accreditation guideline, the assessment tool, the self-assessment guideline, and so on. This was done by the task force, and this was finally approved by ETA, and what we have heard from Dr. Dunkwana, it was using those documents, those program assessments were done, and now they are under process. So, but from our previous meetings with people to people, with the international task force, I have learned that we have a lot to do, specifically to bring the ETA to the level what we require to the international level, especially to make ETA accredited by World Federation for Medical Education, and also the ETA preparedness in terms of human power, financial, for the international accreditation. So these are now awaiting, otherwise many things are done. And the Ministry of Health, what is needs is quality health professionals for quality health services. So that's why the Ministry of Health is demanding. It is doing its own licensure examination test, but that is after the process is ended. But the accreditation is helpful because it touches every process of the health science as well as medical education. So that's why the Ministry of Health is demanding. Me as an academician, as a researcher, I am demanding for our products to be quality, and also for that, I am also demanding the accreditation of our medical programs as well as other health science programs. This will help us for the international competitiveness as well as for the quality of health service in our country. Thank you very much.
Thank you so much, Professor Abraham. Again, I know both of you gave a very brief overview, but there's an enormous amount of work that has been going on in the background. So I think the most important message is to hear from all the key stakeholders of the journey so far and where we are. This is a bit of an overview. So hopefully at the end, when we have discussions, we'll be able to dig a little bit deeper to some of the questions. The next person I'm going to ask is Ato Assegid. And as I introduced him, he is the director of the health workforce in the Ministry of Health, an organization that is very, very closely linked to both the ETA process as well as overseeing quality of medical education through examinations as well as licensure. So they're very, very closely tied with accreditation, but I would let Ato Assegid give us some brief overview again in the role of the Ministry of Health in accreditation and supporting the process and anything that you want to share with us. So Ato Assegid, the floor is yours.
Thank you so much. Can you hear me?
Yes, very well.
Thank you. Good morning, good afternoon, and good evening. It's a great pleasure for me to be here, just sharing the Minister's concern on accreditation. I'm lucky that most of the things has been already addressed by Our Excellency the Minister in her video call and Professor Abraham. So I would like to talk on some of the complementing points. The Ministry of Health's commitment to medical education is of long standing. It originates from our strategy, specifically our HRH strategy and our health sector transformation plan. So establishing acceptable standards for the education and qualification of the health workforce and fostering improvement in the quality of education and qualifications. And they are integral part of our daily routines. We believe that the purpose of accreditation and quality improvement in medical education is to adjust medical education to changing conditions in the healthcare delivery system and to prepare our medical practitioners for the needs and expectations of society. Accreditation and quality improvements are expected to ensure training in the new information technologies in order to help our medical practitioners cope with the explosion in medical and scientific knowledge and technology and inculcate in them the ability for lifelong learning. The ministry has been, in this regard, closely working with Ministry of Education and Training Authority in the past to realize accreditation in our context. So the ministry is very seriously working with all stakeholders, especially to realize accreditation by creating a platform called HRH Steering Committee, which evaluates accreditation as one of a standing agenda with other identified HRH challenges. We have also developed different kinds of education standards, quality standards, which help us to ensure quality of medical education, even though there are limitations on those standards, but they really supported the efforts of quality education in our country. So this stage two, we are seriously engaging in the medical accreditation process as a serious agenda, and we are working with all our capacities to realize global accreditation of our accrediting body, Ethiopian Training Authority. So the final thoughts, accreditation is a risk reduction strategy. It's not an end in itself, but it's more like a biopsy, which provides a diagnosis on the condition of the institution. The value of accreditation is that it provides for a process of improvement and development of the system. So standards and indicators must be identified, but achieving those standards is most of the time is the challenge. So furthermore, evaluation does not have to be all or none process. It can be applied so as to enable all schools to be accredited, but at different levels. So more time may then be spent helping those that are most in need of improvement. So with this, the ministry is very much concerned on this agenda, and we will continue our conversation with this agenda. Over. Thank you.
Thank you so very much, Atasa. Good. Again, like I said, with the brief amount of time that you had, it's a very brief introduction and overview, the key role that the Ministry of Health is playing in this process. So far what we've done is set up for you by introducing the main accrediting agency, and then the Ministry of Health, the supporting institution that works very closely with it. And then the third arm of that support is provided, on a very, very close and important and impactful way by the Ethiopian Medical Association, because after all, accreditation is best judged and brought about by consultation with the professional organizations. And so it was delightful for me to have heard that the Ethiopian Medical Association was involved in this process from the very beginning. So I'm going to invite Dr. Tagvar Yigzau, as I've already introduced him to you. He is the current president of the Ethiopian Medical Association. He does have other roles, but I would like for him to give us a brief overview on his experience, his organization's role in supporting accreditation, where we are, and future plans. Thank you.
Thank you, Dr. Lucky. Can you hear me okay?
Yes, very well. Thank you, Dr. Tagvar.
Thank you. First of all, I would like to thank People to People for organizing this important and timely discussion. As you have rightly pointed out, for the Ethiopian Medical Association, promoting their standards of medical care and medical education are strategic priorities, actually explicitly stated in its current strategic plan. Ethiopian Medical Association has been working with the Education Training Authority, Ministry of Health, Ministry of Education, medical schools, and other stakeholders to medical education to advance quality of medical education in Ethiopia in the last few years in particular. So what role have we played in recent years? We work with ETA in developing accreditation standards for medical education. Even previously, we worked with the Higher Education Relevance and Quality Agency to develop accreditation standards for medicine. And we partnered again in 2020 to update medical accreditation standards. We also worked with ETA to train quality assessors at medical schools to promote the culture of self-evaluation and also implement the accreditation agenda. In fact, this is also supported by a formal memorandum of understanding with ETA that would allow us to collaboratively perform, quality enhancement activities in medical schools. We have also a very good relationship with medical schools. We have a standing committee of medical educators who regularly conduct virtual webinars on medical education topics. For instance, just 2 weeks ago, we conducted a webinar on accreditation and quality assurance. But we have been doing this for the past 2 years. I remember speaking at the Consortium of Medical Schools meeting 2 years ago in Arba Minch to stimulate them, to seek accreditation and work with the Ethiopian Medical Association and ETA to achieve accreditation for our medical schools. We also had recently a meeting with quality assurance directors from several health science colleges in the country, again, to see to what extent they are conducting internal quality evaluation and to encourage others to follow the same. So for the Ethiopian Medical Association, it's important that our medical schools achieve accreditation, nurture a culture of continuous quality improvement, and this is important for our graduates. This is important for our society, to receive high quality care. We're also partnering with Ethiopian Medical Students Association because we want accreditation. We think this would be successful if the pressure and demand is coming from different directions. We want students to push for accreditation We want medical school deans, to strive for accreditation. We want regulatory bodies, to prioritize accreditation. And Ethiopian Medical Association is committed, to contribute its part in this journey. I would stop there, and if there are questions, I would be happy to come back. Thank you.
Thank you very much, Dr. Tagbar. Again, like I said, it's a very brief overview, but I'm really hoping that the message goes across to the audience that the very, very key organizations are playing a role, a collaborative role in this accreditation process. And I think Dr. Tagbar gave us an overview of the fantastic work the Ethiopian Medical Association is doing in terms of providing support to ETA, but also an organization that's the link between accreditation and the medical schools, where they play a role in setting the standards and helping the ETA implement some of those, but they're also playing a very supportive role to the medical schools through continuing education. So I hope that has come across. The next person that I am going to ask to speak is Dr. Amal. As I already introduced Dr. Amal, she's the interim dean of Addis Ababa University School of Medicine. She's also representing the Council of Medical Schools in Ethiopia, or consortium or council. That is the council where all the deans of the medical schools get together. So the accreditation journey, as you see, is very important because the ultimate goal is to accredit medical schools. So none other better person to hear where medical schools are in accreditation and what work has been done and what the future plans are than to hear from Dr. Amal. So I invite you to speak, Dr. Amal.
Thank you, Dr. Lekki. Good morning and good evening to everyone. Thank you for giving me the opportunity to speak representing COM. The Council of Medical Schools was established in 2015, bringing together both private and public medical schools to the same common forum. Addis Ababa University School of Medicine was the host of the founding COM meeting. Now, the Addis Ababa University School of Medicine leads COM as president. COM has been conducting sometimes biannual and other times annual meetings to discuss on several important school common issues, such as the Ethiopian residency matching program, curriculums, and quality of education, academic rules, to name a few. With accreditation of programs being a priority, it was one of the topics of discussion on the 9th and 10th annual meeting held in March of 2021 and May of 2022. Medical schools across the different regions of the country have been actively working to get their undergraduate medical degree program accredited, utilizing the guidelines that have been put forward by ETA. Except for a handful of universities, schools are at different levels in their accreditation journey. Few schools are in the initial phase of the process, while the majority have completed their self-assessment and have submitted their drafts and awaiting feedback from ETA. Some have gone as far as obtaining their feedback. Regardless of the challenges faced, all schools have set accreditation as one of the priority area and have engaged their respective management teams and committed to achieving their goal. It is essential to keep up with the international standards and provide the best opportunities to our graduates. It also gives us the opportunity to identify our gaps in order to improve on our shortcomings. The efforts of the task force and the commitment of both local and international partners is much appreciated, and I hope that we can all achieve that what we have set out to accomplish, which is achieving accreditation to meet the set 2024 deadline. Thank you.
Thank you very much again, Dr. Amal. So I believe Dr. Dawit is not on unless I'm not seeing him, if Dr. Dawit has joined. If not, I will give, I know I'm trying to get this color that's reflecting on my face. There's nothing on my face. I don't know what the color is reflecting. I apologize for that. But anyway, Dr. Dawit Taklu, as I had already introduced him, the commissioner in UAE, he was to give a little bit of his experience with WFME accreditation. Prior to going to the UAE as a commissioner, he had worked in accrediting his organization organizations. His role was in accreditation. I believe he was the senior person at 2 institutions, associate dean and dean for accreditation and assessment. And then the most important reason why we wanted to hear from him on this panel, he is a member of the task force, but also his organization had undergone WFME accreditation. So we thought it would be a wonderful person to have as part of our task force and at this meeting to give us an idea of what the WFME accreditation entailed. That's number one. And number two, I wanted him to give a brief overview of the role of the P2P task force. So I can introduce that. I'll introduce myself a little bit for you to know who I am, since I was just a moderator. I didn't get a chance to say. My name is Lekiderlu Taddese. I am an associate professor at Howard University Hospital Department of Pathology and the College of Medicine. The reason why I am very interested in accreditation and joined the task force to be able to support the work that is being done in Ethiopia is because the medical school accreditation system in the United States is on a peer-based system. The accrediting agency looks for people from different medical schools to go and accredit by assessing other medical schools. And I have worked in that capacity for over a decade. So I know what medical school accreditation entails. And since the system that was implemented by the World Federation of Medical Education reflected very much the system that is currently used in the United States, I thought I would lend some of my experiences to this process. So to give you an idea of the role of P2P, those of us who kind of knew accreditation got together with Dr. Anaugao to try and see how we can contribute to the process that is currently being undertaken in Ethiopia. And as part of that, we formed a task force. And all the panelists that I've introduced to you are on that task force, including many members from People to People, as well as Dr. Anaugao, who was the person who organized it in the first place. And our job is to really, push the agenda by supporting ETA, by supporting the medical schools to help in the accreditation process. So we are trying to play a role, and I'll expand on that a little bit. While I'm doing that, I just want to, sort of reiterate what all the panelists have said to you. And I think what we want to do on this audience is really, first of all, focus the attention on accreditation. And what is the need to focus attention on accreditation? Number one, ensuring quality of medical education is a priority for all of us, period. Okay. The second reason why we wanted to elevate this at the highest level is because we do have pressures from international organizations where there is a push to get accredited. And not only that, we have certain deadlines looming over us that may impact our graduates in Ethiopia. Like I said, the medical students will not be able to enter residency in the United States. But even if you put that aside, many organizations and many institutions are going to implement some form of demanding quality. So we've definitely have a work cut out for us, and we have some deadlines that we need to meet. That's number one. Number two, I want to highlight at this meeting that the process is already in place, that there are very important and key organizations that are involved and working very hard. And I know they didn't get an opportunity to expand on it a lot, but the HRCA, the prior organization that ETA replaced, the Higher Education and Relevance Authority, has over a decade of experience, working with quality and accreditation. Where we are right now at the crossroad, why it's a little bit different and why we want to get together and talk about it and highlight it is because there is a particular way that we're expected to do accreditation by WFME. So we have an external body that is kind of asking things to be done in a particular way. And so that's where this journey is. And that's why we put all of this together. And People to People is supporting this by saying, hey, we've got people who have experience in accreditation. And in fact, one of the members, his organization has already undergone a WFME accreditation. So we're trying to share best practices and help each other out. But the main key players are the people on the ground doing all the work, and that are all these people that I have shown you. So it is extremely important for us to understand that all the major stakeholders are involved. They have put their time and effort and commitment into this process. The medical schools are on board, and they are also putting their time and commitment and effort in this process. So I think all the raw ingredients for success are already in place. The devil is in the details, as they say. We've got a lot of work to do to sort of tighten things up and make sure that we proceed in the way that is expected of us. Okay, now, I would like to open the floor for discussion. If any people have any questions, Dr. Kabede and Dr. Anaugao, I don't know if there has been questions that were put on the chat that you are aware of. If you could transmit that for me, I would be very happy to sort of address that question to each of our audiences. Until you do that, Dr. Kabede and Dr. Anaugao, I can kind of start asking a few questions. So first, like I said, all the raw ingredients are in place and a lot of work is being done. I completely understand that, and I also understand all the major stakeholders are in play. Having said that, I wanted to hear from any one of you what you consider will be the biggest challenge as we move ahead, not just in simply implementing accreditation, but doing accreditation in such a way that it will prepare us for international recognition by WFME. So if anybody is volunteering from the group to speak to what you expect would be major challenges that we'll be facing the journey of accreditation. I'll be very happy to take any of the panelists instead of calling on you. If one of you would like to volunteer to talk about what you see are challenges weighing ahead. Anyone? Professor Abraham, may I call on you? Oh, can you all hear me, by the way?
Here we can.
I'm hearing you. I'm hearing you, Dr. Lucky, but
Yes.
let the others speak. I'm not in a place where I'm just wandering around.
Okay.
And there are disturbances around.
Okay. All right. The reason why I asked Professor Abraham is because
Yes, we can hear you, Dr. Lucky.
Very good, very good. The reason I asked Professor Abraham, I know he's been in this process a long time, and he has a perspective both from the medical school side, having been a dean, and working with the Ministry of Health specifically with supporting accreditation. But Dr. Dunkana, I can ask the question of you. What do you see as being a biggest challenge, not just in simply implementing accreditation, but specifically undertaking the journey towards international accreditation? Thank you.
Can you hear me?
Yes.
Yeah. Really, to say something about my experience, and I am a good practitioner. I know how to launch program, how to run program, because I worked at executive level at universities for a decade, and we need a due attention, because accreditation is not mechanical, it is too technical, and everybody should be aware, especially the medical school or health science peoples, including the academicians, and it requires a concerted effort from all stakeholders. We have to work closely, and on the side of ETA, we need really support, especially technically and materially, because we have to be aware about the technical part of accreditation, the process of accreditation. And as ETA, we have a good experience in quality audit. And when we come to accreditation, and it is an evidence-based, so outcome-based and output-based. So it requires some technical support. Also, we have to be close enough with the institutions as well as the program owners. I mean, the medical school, College of Health Sciences, and etc. And I think really practicing, and we are in a good position, but we need technical support, especially in terms, and as it is mentioned before, I think to talk on the issue, and I think I hope we'll do, but we need still support, especially technical.
Okay, thank you so much. And either Dr. Tagbar or Ato Assagid, again, if you can, either one of you speak to what you think are the biggest challenges. I know Ato Assagid, you have the Ministry of Health's perspective. Dr. Tagbar, you do have the perspective of the professional association, and you interact with the medical schools. So I just kind of wanted to hear from you. And then after you give me your perspectives, Dr. Amal, maybe you can also speak from the medical school side, what you see as being the biggest challenge waiting for us.
Thank you. Can I continue?
Yes, that was good. Thank you.
Thanks so much, Dr. Leki, for bringing this to our attention. I think one of the major challenges in the journey of accreditation in our context was, the first thing, the value given for accreditation was, very low, because if I talk about, the development of workforce development in our country, we're very concerned on numbers only. We didn't give enough consideration for quality related aspects, because when
hold on. Good.
Yes.
Okay. Thank you, Dr. Tagbar. Any comments?
No, actually, I didn't finish.
I'm sorry, Good. Please,
Yeah,
when you pause, okay.
Talking,
yes.
Yeah, I think so. The value given for accreditation was very low, as I said earlier, because when we just look the journey of the workforce development in our country, Ethiopia was one of the countries with critical manpower shortage. So the first intention was, improving the number of healthcare professionals. So in the meantime, we were not very much concerned on improving, the quality on the accreditation issues. That was, the issue. But these days, there are lots of improvements. It starts from, the area where we started working on workforce development. The second one I see is, in most of the medical schools, they assume that the standards are very high to meet within a very short period of time. Because we were thinking to meet a global standard, the standard is from ETA. So the medical schools, think in order to achieve all these standards, it might take a very long time to meet all standards. So assuming and thinking, taking long time to meet the standards is one of the challenges as we observe in most of the medical schools. The preparedness is also the challenge. From the recent experience, we just sent a self-assessment guide to some of the medical schools. Some are very interested to meet to fulfill the self-assessment guide within the requested time, but some are, they are not in the place where to meet the self-assessment guide within a very short time. This is, related with the preparedness, and it also related with the value-related aspect. So consistency is also the challenge that we see in some of the medical schools. They have different kinds of initiatives. So they started one initiative, they finished the initiatives, but being consistent in accreditation, being consistent in most of the initiatives is a challenge. So if we work in some of these challenges, I think it will help to meet the objectives and the plan that we have started to go for global accreditation. These are my observations. Thank you.
Thank you very much. Excellent, excellent comments. I think you've touched upon all the important areas that I think we might be facing some challenges. Dr. Tagbar, if you want to put in your comment, and followed by Dr. Amal.
Thank you, Dr. Laki. I think two important challenges I think we need to overcome. One is related to ETA. The second one is related to medical schools. I think with ETA, the challenge is, ETA has been provided a very expansive role and responsibility. Now it's regulating not only higher education institutions, but the entire education training in Ethiopia. Regulating higher education by itself is a daunting task. With that, massive mandate, I think the capacity to effectively carry out its roles and responsibilities, I think is going to require a lot of help, collaboration, a lot of resources and time. So I have that concern with the expansive role of ETA. The second one is, I think rightly, there are priority challenges ETA is preoccupied with mushrooming of private higher education institutions, fraudulent documents, unacceptable admission of students. ETA is trying to manage those challenges, and that seems to be a priority preoccupation for ETA. So, because of the capacity versus the expansive mandate it's given, and the preoccupation with other issues might limit, or slow, engagement of ETA with accreditation of medical and health professions education. That's one concept. But with the collaboration with professional associations, Ministry of Health, and now with people to people, I think we might be able to help ETA, accelerate or increase its capacity to conduct healthcare or medical education accreditation. With respect to medical schools, if I provide you one statistics, in 2020 we conducted an assessment, and one of the questions we asked was, have you conducted institutional, self-review in the past 1 year? And our finding was majority of medical schools didn't conduct, self-assessment in the past 1 year. And even over the past 1 year with ETA, we have been, encouraging schools to conduct self-assessment, and we also conducted external assessment in a couple of institutions. And what we see is, even in institutions which have conducted self-assessment, I think the quality of self-assessment, the using the opportunity for in-depth review of quality, the engagement of key academic leaders in the quality review process has not been sufficient. So the culture of continuous quality improvement is still something that needs to be developed. So understanding what it takes to properly conduct quality assessment and having that culture of doing it regularly on a yearly basis on part of medical schools, and the capacity of the regulator, to conduct efficient and effective quality assurance right now. I see these are big challenges, I think, but they are surmountable challenges.
Excellent, Dr. Tagbar. Thank you so much for that insight. Dr. Amal, if you can give us a little bit of what you think would be challenges in the from the medical school perspective. I know Dr. Tagbar and Dr. Sagid touched upon that a little bit, but if we can hear from your perspective too.
Thank you, Dr. Laki. Yes, as you mentioned, Dr. Tagbar and Dr. Sagid have mentioned most of the challenges. The financial aspect is one challenge, but schools have made it a priority, and the management of most schools are on board. So they are moving forward with the accreditation process. The other thing is perhaps schools are at different points of their journey. Some have finished, as I've mentioned. Others that have started or are in the initial phases of starting are a little concerned that they might not meet the deadline that has been set. But regardless, I think all schools are moving forward. We're hopeful that we can meet the 2024 set deadline by WFME because we are responsible for our students. And I'm sure we will be pressurized also from our students as the time approaches. So that's one thing that we have to deal with. And we do have a lot of support from the Ministry of Health as well as from EMA, which has been quite helpful with all the trainings that they have been giving to kind of make all involved and all people who are in the management position to feel comfortable in moving forward. So time is of the essence, and that's what we're all worried about at this point. Thank you.
Thank you very much, Dr. Amal. As you can see, the importance of challenges waiting ahead of us that we need to tackle and be cognizant of. It's not just a question of us saying that we're going to do it, but we're also talking about all the things that we expect in a realistic way. I wanted to show you just this one thing that was in my presentation. For the interest of time, I had cut it out, but I think it's important to show that now that we were talking about the challenges. I don't know if you all can see my screen.
We can see it.
Yes. So the reason why I put the screen up here is when we talk about challenges, I want to put it in perspective. In the United States, from the inception of the first medical school to full implementation of accreditation from 1765, first medical school established to 1942 was 177 years. So we need to be realistic that it takes a lot of time for this kind of work to be done. And there's going to be challenges without a doubt, but we're trying to accelerate time. So I'm looking at this. If I'm not mistaken, Addis Ababa University was the first medical school that was established in 1963. Am I correct? If not, I stand corrected. Somebody can correct me if I made a mistake. Did I make a mistake?
I think you should know it. You are the alma mater of that medical school.
The reason I'm saying is I had heard some people say Gondar, but then Gondar was established as a public health. So I don't know. Sometimes I tend to.
Gondar, I am a graduate of Gondar. So the medical school started, I believe, in 1983 European country.
Okay. So I believe I'm correct.
Addis Ababa University is established in 1964.
Okay.
Gondar as a medical school in 1979.
Okay.
But Jumma as a medical school in 1984.
The reason why I put this slide to give us a perspective from the first medical school to where we are now working with accreditation is only 60 years, as opposed to the giant American institutions that took them 177 years. Okay, so we got to remember that, and I think this is important for me to share to put it in perspective. So when we say we've got a lot of work waiting for us, it was a daunting task even for the other institutions that had a lot more experience than what we did. Now, why I wanted to state that is I know there's a lot of challenge, and I also want to tell you this task force from which all of these presenters are members, as well as others from People to People, we talk about these things. We talk about capacity, we talk about challenges, and we're talking how to proceed forward to help in that regard. Okay, so the purpose of this to introduce to our audience, where are we, who are the key players, what has been done, what are challenges, and how we're moving forward, and that accreditation is a major focus at this point, and I'm hoping that message has gone across. Now, to go back to Dr. Tagbar's comment about capacity of ETA and sort of focus on the medical education aspect of it, I also want to remind you that WFME only recognizes governmental authorities as being the bodies that have the mandate to accreditation. So ETA is the right body that has the mandate. What we need to do moving forward is to see how we can potentially accelerate their implementation for the medical education accreditation. But all the key players and all the work is in place. It is a daunting task, but we are committed. So, and People to People has put this group together that are very interested, very committed, and have the experience in accreditation. And I think we're having incredibly fruitful discussions when we meet, and specific action items that we're implementing. So I wanted to get that message across. Now, if there are any questions from the audience, please let me know. But what I want to say is, what is the message for the audience? In addition to giving you where we are with accreditation, what it is, who are the key players, what has been done, and how we move forward in the challenges. I also want to say, if you're sitting in the audience and listening to this, and you're asking yourselves, how can I be involved? What role can I play? Whether you are in Ethiopia and are part of the medical schools, or you are the diaspora, anywhere where you may be, quality medical education has a lot of arms that can use support, from being, adjunct professors that give lectures and training and teaching, to, collecting resources from wherever you are to help the medical schools, to understanding what their gaps are, specifically when it comes to accreditation. And so anybody in the audience who is interested to improve the medical education can play a role, no matter how simple, in their respective areas, to improve the quality medical education. So every little thing that we put in is going to add up to the big picture. So I invite everyone who is interested to please reach out to, whether it's People to People, the individual medical schools, the accrediting bodies, to see what role that you can play. When we say we got together, it just so happened that we, found each other. So this is a great forum to introduce to anyone out there, whether you have specific interest in accreditation, program implementation, want to get involved in quality, and want to contribute, with the goal being to get medical schools to be accredited by ETA for their medical education programs specifically, and for ETA to get a WFME recognition. We welcome your support, we welcome your comments, we welcome your help. The bigger the input, the more the value and the more impact it will have. So this is my message to the audience. If there are any questions from the audience, yes.
There are some questions and comments.
Yes.
The first one is maybe the other people may speak there, or you might, since you have been interacting with them. Is there any timeline for the different activities that need to be achieved for the goal of having the ETA to be accredited by early 2024 or the end of 2023? That's one. The other comment is for ETA. The comment is there are technical issues that they have a problem. Can they be much more specific, so it will be much more easier for you and others who are facilitating the success of this project? Thank you.
Thank you very much. Dr. Dunkana, I'm going to come to you, since both of the questions were sort of addressed to ETA. I will let you address the question about the technical issues or any things that ETA may be facing to in what way we can support and to overcome, if you can address that, and if you can also address the timeline. Otherwise, I may speak a little bit about the timeline, but I will give you the floor, Dr. Dunkana, if you can please address the comment and the question.
Okay, thank you for giving me chance again. Really, yes, I want to say something to the question as well as the concern of Dr. Takbar. Especially my worries not on the side of ETA, but my worry is on the side of medical schools. Even at schools, found at school, technically about the value of accreditation. Are they really aware about the value of accreditation, and are they technically oriented toward quality so that we can accredit at the last day? And this is my worry, my concern, because I know about the programs, because I was working as vice president, academic vice president and research vice president at universities, and I know technically how programs are running. And when we come to international accreditation, it's not a such easy task to achieve that. Assuring quality is principally that of the institutions and the programs. They have to, and our position is to make accountable the programs or the institutions. So when I come to my word technical, we need, of course, some trainings from international experts on the processes, while we are developing instruments, checklists, when we are developing standards and actual practice also. Of course, we do have a good experience in quality audit, and the quality audit are similar, even though their focus are different, and it is risk thinking. My worry is still to add more, not on the side of ETA only, and are they working? That is my worry. And also materially, we have to be equipped in different, we need financial support too. These are my concerns. Thank you.
Thank you, Dr. Dunkana. And would you like to also address the question in terms of the timeline, specifically the timeline for ETA to seek accreditation from WFME? I believe those were the two questions. So if you can just say anything about where ETA is in terms of planning for the WFME international recognition application.
Concerning, I think we have to talk seriously about this accreditation internationally from medical practitioner. Exactly, I cannot say exactly this, but I think we have to work hard on this issue. Thank you.
Yes, thank you very much. I thank the person, or if there are more than one person who asked the question and made the comment. There is no doubt that there are challenges. The most important message that I want to send from here is the key organizations are all represented. They're working hard, but the loose ends need to be tied together. to undertake this specific journey. As you should understand, when a national organization such as ETA is mandated with accrediting all learning institutions, they have a lot of competing priorities, without a doubt. And to be honest with you, there is no organization that's going to start its process by saying, I'm going to align everything that I do to allow me to get international accreditation from the get-go. When they're mandated to accredit educational institutions. So trying to piece the two together at the same time, where they're also doing all the work that's demanded of them, and trying to go along that pathway for the international accreditation is a bit of a challenge, but that's the role that Ministry of Health and the Ethiopian Medical Association are playing to guide them to you know, like I said, because of the constraints of time, we didn't go elaborately, but the amount of work that has been done by the previous HERCA in just setting the standards and making sure the standards abide by the WFME requirement, the training that has been done to the medical schools, both by ETA and the EMA, Ethiopian Medical Association, to prepare medical schools. A lot of work has been done. What needs to go on moving forward is to develop a very specific plan and a very specific timeline with a very specific checklist to make sure that we're doing everything we're supposed to reach that goal of the international accreditation. So to address your question about the timeline, the work has already begun. That's part of the process, is coming up with a plan that will enable us to have milestones, because WFME expects you to do it in a very specific way. And that's what this task force is pushing. We're pushing for timeline. We're pushing for things to be done in very specific ways, aligning all the work that has already been done in a way that will get us to that. But there are challenges, but I want you to rest assured that everybody's working on their side. The people on the ground are doing everything that needs to be done. We just need to align it in a way that will get us to where we need to get to. And I hope that answers your question. And if there are any other questions and comments, we'll be happy to take that.
Thank you, Dr. Lakidelu. There is one more question from the audience here.
Thank you, Dr. Lakidelu.
Yes. Yeah, who the question is coming from? Dr. Kabada, I think you disappeared.
No, I am here. It's coming from Dr. Abraham.
Okay, Dr. Abraham, please. I think he lost his audio and he's reconnecting. Okay, Dr. Abraham, please proceed.
Thank you, Dr. Lakidelu, for a nice presentation, and I would like to thank also our friends in Ethiopia for joining us. As you know, that on our bi-weekly meetings, the only person we were missing at that time was the ETA director. Now we have the ETA director, and I would like to ask him one question. If you remember, WFME is requiring, there are some criteria for the members of this ETA, for Ethiopian accreditation body, because that's the most important accreditation body that the WFME is going to look into. So what is the composition? What is their qualification, your group's qualification? Did they meet the criteria of the WFME?
Dr. Dunkana, if you want to address that question about the composition of the committees that are in ETA that at all levels address the program accreditation for medical schools.
Okay. Anyway, I recently joined this 3 months ago, only this line accreditation. I was working on quality audit and exactly I'm not clear of the process of WMCE yet. Some work has been done yet, and I have to try to adjust if there is need change on some issues, the concern which is already mentioned, because we have to work again, and we have to see even the standard is developed, the instrument is developed. So right now, I cannot say the professionals, I cannot mention them directly, but the work is on progress. And I'm very much interested on this work because we will learn a good lesson after all, and we will focus on it. Personally, I'm very interested, and I will focus on the accreditation of medical programs so that we can we can give priority. That is not an issue for me, but we have to work closely with the medical schools and the medical association and the rest stakeholders. And if it needs, we can. Thank you.
Thank you, Dr. Dunkana. He's absolutely correct, Dr. Abraham. He is relatively new to this part of the process, and we will address all those specific questions in the task force as we move forward. The main purpose of this meeting is to introduce everybody, showcase all the work that they've done, the collaborative work that's going on, the commitment, and I hope the audience gets that, that all the key leaders and the key players are very, very well engaged and working incredibly hard. And I'm very grateful to them. And I'm actually very honored to work with a very distinguished group of people. I thank you all for your commitment. I thank you for all the hard work that has been done. And I want the audience to understand that there's a lot of commitment and hard work coming from the group that we've introduced to you. So if there are no comments or questions, somebody needs to mute theirs, or there's an echo. I would like to invite Dr. Naugao to say a little bit of a remark, because after all, he is the person who brought the task force together. And also he's the person who's responsible for, putting the focus on accreditation, encouraging all of us to participate, encouraging all of us to giving his wisdom and leadership to this effort. So I will invite him to say a few words specifically about accreditation, his role, the role of P2P, and how he brought this incredible group of people together to achieve a common goal that we think is incredibly important and will support all medical educations in Ethiopia. So Dr. Naugao, the floor is yours.
Thank you. Thank you, Leki. What an incredible panel. And you guys are really you give us energy. So today is actually a special day in a way, because we had the Minister of Health, who actually blessed by her remark at this conference, and who expressed her interest that she's with us. By that, with the team. And also, Professor Brano expressed yesterday by WhatsApp, but he couldn't make a comment due to some traveling logistic. But on the other side, here where we are, we have professors, academia, we have university presidents. So the whole point was to bring together the outstanding Ethiopian team on the ground, who in fact, if there is anything that happened, it has to come within, and we have that team. And yet we have a leader like you, and we have the university presidents, professors from the diaspora. So everybody, thanks for technology, although we had people who were not happy with us, but thanks for technology. We made it possible. And we have experts from Sweden, Human Bridge. We have the diaspora from California, Arizona, you name it. So I think this is a special day that we were able to bring everybody, stakeholders together. And now, although the initiative was started like 7 years ago, and it was a very good comparison, Dr. Leckie, when you said here in America, maybe like so many years ago happened, but in our country, like 7 years, that's still baby. And we are learning from everybody's experiences. Our people-to-people its job is to bring together and building the network and bring the right people, the right experts, so that our country will advance with a better healthcare and better education. We learned one thing, that no country in the world has developed without good education, good health, and good manpower. And that's all what it is. I think we all agree, accreditation is just quality. Everyone here, we are the product of education, and we all agree, quality is important. We wanna be, when we get sick, in the right hand, and we wanna send our kids to the best school. So quality means development, and I think I cannot be any more happier than today. This is a good start. It's a good fuel to everybody, and I cannot thank you enough. Your leadership is impeccable. Thank you.
Norman, thank you so much. Like I said, you're the person responsible for bringing all of us together here in accreditation. And what the lessons that I have learned from the incredible leaders that are represented here, their wisdom, the hard work they've done, their knowledge, their guidance, we're just a little drop in the ocean trying to make a little bit of a difference by helping, but we are committed, we're all committed, including Dr. Dunkana, who has assumed this new role, and we will work together to make this a reality. So I thank all of you from the bottom of my heart. Dr. Kabada, I turn it back to you.
Thank you, Lucky. Really, it was extraordinary presentation, and all of us are learning. And again, it is a recommitment for the success of the project. All of us are working for our customers. The customer is always right. Our customers here is the people of Ethiopia from corner to corner. Thank you. This will conclude the first session, and we'll have 10 minutes break to start before the next session, coffee break. Thank you very much.